Older adults also have decreased muscle tone and strength, decreased endurance, and decreased reaction time. They tend to have a sedentary lifestyle that promotes degeneration of the musculoskeletal system, and if a routine exercise program and well-balanced diet is being continued, then progression tends to be slower. Safety tips to decrease fall risk include avoiding scatter or throw rugs, slick floors, dim lighting, clutter, cords on the floor, ill-fitting shoes, and stairways without banisters. When you think of reviewing specific symptoms, this can include joint hypermobility. Joint hypermobility is the ability to oppose the thumb passively to the forearm and hyperextension of the fingers. Greater than 10 degree of hyperextension of the elbows and knees, and the ability to touch the palms of the floor with flexion at the waist. Joint cracking is not significant unless accompanied by pain, and the probable cause is due to the tendon of ligament slipping over a bony prominence. Crepitus is a grinding sensation with palpation of joints during motion, and it may originate from irregularities in the cartilage, bone-on-bone articulation, and tendon abnormalities. This too is not significant unless accompanied by other signs and symptoms. Joint warmth is always abnormal. Joint tenderness, you have to look at the sign of the joint pathology. Joint swelling, again, you have to look at the sign of joint pathology and know the type. So there's synovial effusion, synovial thickening, and periarticular tissue inflammation. Joint deformities can be due to a malalignment of the joint, and that can include bone enlargement, dislocation, articular subluxation, or contracture. Joint instability is the movement in any plane greater than normal. When you think of tendon injury, you also will think of tendinitis. That's the general term to describe disorders of the tendon and include tears in the body of the tendon or at the bone attachment, and inflammation of the synovium, or the sheath of the synovium and the connective tissue covering the tendon. You could also have ligament injuries. Those findings dependent on the degree of injury. Tenderness is present over the ligament, and including when they stretch the ligament, that can produce pain. It can also cause significant disruption of the ligament, and that results in abnormal motion of the joint and gapping with the stretching of the ligament. Ecchymosis can also be seen over the site of injury. Bursitis is identified by point tenderness over the bursa, and in superficial bursa, an effusion can be appreciated.